Right, so today we're diving deep into the world of orthodontic treatment.
Sounds fun.
But specifically, we're going to be focusing on
Okay.
something called class I malocclusions.
All right.
And, even if you haven't experienced this yourself,
Right.
understanding, like, this terminology
Yeah.
really unlocks this whole new understanding of how teeth move
Uh-huh.
and how dentists kind of approach,
Yeah.
creating those, like, perfect smiles that we see.
Mm-hmm.
So I've got an expert here with me today who's going to break all this down
Absolutely.
in a way that even I can understand.
All right. I'll try my best. So class I malocclusions, they're super common.
Okay.
We're talking about things like,
Okay.
crossbites, where the upper teeth bite inside the lower teeth,
Mm-hmm.
diastemas.
So that's the gaps.
Yeah, those spaces between the teeth.
Okay.
Even tipped teeth or problems like maintaining the proper arch length.
I see.
These all fall under this category.
So it's like even though the jaw itself is like in the right spot,
Exactly.
the teeth are kind of
Yeah, the teeth themselves are the problem.
like puzzle pieces that don't quite
Yeah, you got
fit together.
That's a great analogy.
Okay, so like even those small misalignments, they can impact the bigger picture, right?
Absolutely.
Yeah.
And, they can affect your bite,
Right.
your ability to chew properly,
Makes sense.
and even your speech in some cases.
Okay, so then let's talk about the tools
Okay.
that dentists use to fix these class I malocclusions.
Sure.
Because I know they've got like a whole
They do.
arsenal.
Yeah, we can broadly categorize them
Okay.
into removable appliances
Uh-huh.
and fixed appliances.
Okay.
So removable appliances, as the name suggests, can be taken out of your mouth.
Right.
Think retainers.
Okay.
Those are a classic example. They
Yeah.
use gentle force, often with springs,
Okay.
to kind of nudge the teeth into better positions.
Got it.
So retainers are like the gentle nudgers.
Okay, so then what about those fixed appliances?
So those are the ones that are attached to your teeth for a longer period.
Okay.
Braces.
Right.
They use wires and brackets
Yeah.
to apply more controlled, multi-directional force,
I see.
allowing for more complex tooth movement.
And our research said that the ideal force
Oh, wow.
for moving a tooth is only 30 to 40 grams,
That's right. Yeah.
which is like, that's incredible. It's like such a delicate,
It is. It's a very precise process.
it's like a delicate dance.
Exactly. And too much force can actually damage the teeth
Oh, wow.
and surrounding structures.
Okay, so let's get into some specific
All right.
conditions.
Sure.
What about anterior crossbites?
So anterior crossbites happen when your upper front teeth bite behind your lower front teeth.
Okay.
This can affect not only your bite,
Okay.
but also the growth of your upper jaw, potentially,
Oh, wow.
leading to crowding.
So it's not just like how the teeth
No.
look, it's like how the jaw.
Exactly. And to make things even more interesting,
Okay.
we have to consider the difference between centric relation
Okay.
and centric occlusion.
Centric relation and centric occlusion. Okay.
Centric relation is the position of your jaw when it's completely relaxed.
Okay.
Centric occlusion is how your teeth fit together when you bite down.
No.
And sometimes there's a shift in jaw position between these two states.
It's almost like your jaw is like compensating
Exactly.
for the misaligned teeth, almost to like create this optical illusion.
Yeah, it's like someone has a pseudo class 3 malocclusion,
Oh, wow.
which means their jaw shifts forward when they bite.
I see.
It might look like they have a more severe jaw issue than they actually do.
So the dentist has to be like a detective.
Exactly.
Be like, okay, well, what's really going on here?
Absolutely.
What are some other factors that,
So the degree of overbite is another key element.
Okay.
A deeper overbite can actually be helpful for retention after treatment.
Okay.
Conversely, if there's little or no overbite, we might need to use special appliances like posterior bite blocks to create space for the teeth to move.
So each case really is like
It
a
is.
unique puzzle.
It is.
Okay, so we've covered the front teeth.
Right. Yeah.
What about the back teeth? What about posterior crossbites?
With posterior crossbites, the upper back teeth bite inside the lower back teeth.
Mm-hmm.
Again, there are multiple potential causes.
Okay.
It could be the way the teeth are tilted,
Huh.
a shift in the jaw when biting,
Okay.
or even the patient's age can play a role.
And it's interesting because our research talked about how dentists might intentionally overexpand the arch
Yes, right.
during treatment, like to give those teeth some extra wiggle room
Absolutely.
so they don't revert back to their old positions.
It's all about long-term thinking.
Yeah,
We want a stable and functional bite
that makes sense.
that's going to last a lifetime.
Okay, and then let's talk about molar uprighting,
Sure.
which I'm guessing is
You got it.
straightening tipped molars.
That's exactly what it is.
Okay.
And this is often necessary when a tooth is lost prematurely,
Okay.
causing the surrounding teeth to drift into the empty space.
And I remember from our research that the timing of tooth loss,
Yes.
especially during childhood,
Yes.
can have a huge impact
Absolutely.
later on.
It can.
Because losing a tooth too early can just, like, trigger this cascade of problems.
It underscores the importance of regular dental checkups and early intervention.
Yeah, catch those issues early, and you can
Yep.
prevent bigger headaches down the road.
That's right.
So when we're talking about molar uprighting, like, what are some of the things that...
Well, we look at things like the patient's periodontal health.
Okay.
So that's the health of the gums and the supporting structures.
Got it.
We also consider the position of other teeth in the arch, the vertical dimension of the bite, and whether wisdom teeth are present or not.
So they really have to look at all of these interconnected
We do.
elements.
It's a holistic approach.
Yeah, okay. And then let's shift gears a little bit
Right.
to diastemas,
Okay.
those gaps between the teeth.
Yes.
Because I know a lot of people are self-conscious about that.
They are.
What are the options for closing those gaps?
So we have both removable and fixed appliances
Okay.
at our disposal for diastemas.
Okay.
So for simpler cases, a removable appliance with finger springs can gently guide those teeth closer together over time.
Okay.
For more complex cases, fixed appliances like braces offer more precise control.
I love that detail in the research about
Yeah.
how dentists might use composite resin buildup along with the braces.
That's right.
It's
Yeah.
almost like they're sculpting the teeth to
Exactly.
create the perfect shape.
It's a combination of artistry and dentistry.
Yeah, and it's all about harmony, right?
It is.
And speaking of harmony,
Yeah.
we need to talk about maintaining the overall arch
We do.
length and width.
Absolutely. And there are a few key appliances that come into play here.
Okay, hit me with those fancy terms.
So we have the lower lingual holding arch,
Okay.
transpalatal arches,
Uh-huh.
and the Nance holding arch.
Wow. Okay, so break those down for us.
So the lower lingual holding arch is a fixed appliance
Okay.
used to maintain the length and width of the lower arch.
Got
We often use it when a baby tooth is lost too early to prevent crowding.
So it's like a placeholder until
It is
the permanent tooth comes in. Transpalatal arches are...
They're similar, but they're used in the upper arch, often after expansion.
I see
You
it.
prevent those molars from tipping back inward, making sure there's enough room for all the teeth.
It's almost like adding a reinforcing bar to the
You got it.
dental arch.
That's a great analogy.
And then the Nance holding arches.
So the Nance holding arch is specifically designed to maintain the length of the upper arch,
Okay.
preventing those molars from drifting forward.
Wow, so it's like each appliance is this specialized tool
It is.
in the dentist toolkit.
You got it. And just like a skilled craftsperson chooses the right tool for the job, orthodontists carefully select the appliances that best address each patient's unique needs.
This has been so eye-opening.
It's a fascinating field.
We've covered so much ground already.
We have.
From, like, the nuances of class I Malocclusions to all these amazing tools.
Yes.
But we're not done yet.
No, we're not.
We still need to talk about retention,
That's right.
which is what keeps those beautifully straightened teeth
Yeah.
in their new positions.
Exactly.
So hold on tight, everyone. We'll be right back
We'll be back.
to unravel the mysteries of retention
Yeah.
and explore those all-important retainers.
Well, wait.